Well, when emergencies like the shooting in Tumble Ridge happen, it's police, paramedics, and other first responders who rush in to help. However, those people can struggle to find help of their own once the trauma is over. The Alberta First Responders Association is trying to help. There's a mental health and appreciation conference and gala here in Edmonton coming up in March. Jerry Galliford from the association joins us, along with registered psychologist Kathy Rolfe with Balance Psychological Services. Welcome to you both. Thanks so much for being here.
Thank you.
Jerry, let's start off with you. What kind of challenges are your members facing right now?
So the biggest challenge that people are facing is stigma. Finding the help that they need as well is going to be hard. They have their own employment access for mental health resources, but they're finding struggles there just with the privacy side of things.
Okay.
So
yeah. And it is tricky to try to organize, which is what your group is trying to do here. And Kathy, you're going to be speaking at the conference that's coming up in a few weeks.
I am.
Can you talk about your role and what you'd like to address?
Well, I'm actually going to be speaking on identity loss in first responders who end up having to retire medically because of their PTSD. And so certainly that's a very impactful event for a first responder, because certainly they really identify with their role. And so certainly when they lose it and they lose their position and their job because of a psychological injury, they're really left with sort of almost like an existential crisis around where do I fit in the world and how do I define myself now? And so my talk is really about what are the tools we can use, what strengths can we draw from, and really kind of in that journey of redefinition, how you can also find resiliency and some hope.
And what would you have as far as advice right now? There's first responders who are watching right now, whether they're retired or they're in the job right now. What would you say to them?
I would say on the job, get a therapist early, talk about paint drying if you have to, but develop a relationship and demystify that process. Truly, it's important to just take care of yourself. And, I think like a lot of the time, to Jerry's point about stigma, it's really important to recognize that, the ability to get help is out there, and it's okay to do that. And I really think that through efforts like this, there's a lot of shifting in that mentality in the first responder world, which is really great.
Very great. Now, Jerry, the conference is coming up for people. There's still space available for people to attend. So what kind of things are available at the conference and the gala?
So we have the 3 speakers coming in to talk about their topics, and then we have a group from universities coming to discuss a study they did regarding dispatchers and the mental health around dispatching. And then we have therapy dogs coming to hang out, and we have some masseuses coming as well to volunteer and give some massages during the day.
Now, I had an opportunity to be there last year. We're seeing some pictures from last year. Really, community within different organizations is something that is really achieved here, because there's all kinds of different first responders who attend. Isn't that right?
Yeah, that's right. There's so many different silos that we have between police, fire, ambulance, corrections, dispatch, search and rescue. And we're just trying to bring everybody together into one group and open communication and have better relationships.
Well, thank you both for being here. We really appreciate your time this morning, and there's plenty more ahead here in Edmonton. If you'd like to attend or learn more information, you can visit ourafra.ca. The link is there on your screen. There's also links to the tickets and conference on the website.